everyone which is working currently on breast cancer is looking forward to the presentation of the OlympiA trial. So the adjuvant trial with Olaparib in BRCA mutated patients, which were both triple negative and hormone receptor positive HER2 negative patients. So we know there was a press release. We know the study is positive, but we don't know the data yet. So I think everyone is looking forward to seeing the data and really understand if there's a subgroup of patients which benefit, if it's all the patients which are going to benefit, and this is going to change our clinical practice, and if PARP inhibitors are really going to go ahead also in the early breast cancer setting. I think this is really the major outbreak in the field. And then there are a series of very, very interesting studies, in fact, being presented. Continuing, I think some of the major themes in ESMO and ASCO this last year was regarding adjuvant treatment for high-risk hormone receptor-positive HER2 negative patients. In this setting, the data from the OlympiA trial will be very important. And there's another study, which is translational from the PENELOPE-B trial, which I think is very interesting. So they analyzed intrinsic subtyping of breast cancer according to PAM50, and so they identified a very high percentage of luminal-A patients in their study, which might be compatible with the fact that we're in fact selecting patients who did not respond well to neoadjuvant chemotherapy. So maybe they enriched the population that way with luminal-A patients. And in fact, the numbers are small, but it seems that there was some kind of potential benefit for CDK inhibitors as adjuvant treatment in the luminal-B subpopulation. So I think that's the data we should take into account, especially in light of the fact that we are seeing some important discrepancy in the results of adjuvant trials with CDK inhibitors. So I think we need to really look further in the biology of those tumors. We're probably having some mixed population of tumors there.